Good afternoon, students. Today we will see the medical surgical nursing most important and previous questions. First question. In a patient of a stroke, dexamethasone is administered to option A. Increase intracranial pressure. Option B. Reduce intracranial pressure. Option C. Increase renal blood flow. Option D. Decrease renal blood flow. The right answer is B. Reduce intracranial pressure. When we are giving dexamethasone of stroke patients, it reduces the intracranial pressure. Next, the nurse can best prevent foot drop for the bed rest client by the use of option A. Traction, option B. Splint, option C. Cradle, option D. Railing. Option B is the right answer. Splint. Next, third question. In a lumbar puncture, needle must be inserted into option A. Subarachnoid space, option B. Sinus, option C. Inbone, option C. Pia mater. The right answer is option A. Subarachnoid space. Next, fourth question. Injury to which part of the brain is particularly likely to cause death? Option A. Cerebrum, option B. Pons, option C. Medulla, option D. Hypothalamus. The right answer is option C. Next, fifth question. Which of the following antimicrobial drug is suitable for treatment of both tuberculosis and leprosy? Option A. Isoniazid, option B. Rifampicin, option C. P-amino-salicylic acid, option D. Streptomycin. The right answer is option B. Rifampicin is the right answer. It is the treatment of both tuberculosis and leprosy. Sixth question. Metastasis is the process by which? Option A. Normal cell division, option B. Cancerous cell spread through the blood of limb or lymph, option C. Cell divided into 4 daughter cells, option D. None of them. Option B is the right answer. Cancerous cell spread through the blood or lymph. That is called metastasis. Next, seventh question. What may cause a person's ear to get hurt during takeoff or landing of an aircraft? The right answer, option A. Stretching of the tympanic. Option B. Damage of vesicles. Option C. Increased production of cerumen. Option D. Tear in tympanic membrane. Option A is the right answer. Stretching of the tympanic. Tympanic is a part of ear. Next one. Eighth question. Dysphagia refers to option A. Difficulty in breathing. Option B. Difficulty in swallowing. Option C. Difficulty in speaking. Next, option D. Difficulty in walking. The right answer is option B is the right answer. Difficulty in swallowing. Dysphagia means difficulty in swallowing. Next, ninth question. Ammonia excretion by the kidney helps to maintain option A. Osmotic pressure of the blood. Option B. Acid-base balance of the blood. Option C. Low bacterial level in the urine. Option D. Normal red blood cell production. Option B is the right answer. Ammonia excretion by the kidney helps to maintain acid-base balance of the body. Next, 10th question. Fever can cause which of the following problem? Option A. Fluid loss. Option B. Hypernatremia. Option C. Hyponatremia. Option C. Hypokalemia. Option A is the right answer. Fever can cause fluid loss. Next, 11th. In which of the following condition the client will have flushed dry skin? Option A. Edema. Option B. Shock. Option C. Dehydration. Option D. Hypervolemia. Option C is the right answer. Dry skin means dehydration. Next, one of the most common complications of myocardial infarction is option A. Hypokalemia, Option B, hyperkalemia. Option C, cardiac enlargement. Option D, cardiac dysarrhythmia. Option D is the right answer. Myocardial infarction common complication is cardiac dysarrhythmias. Next, 13th question. The function of coronary artery is option A, carry blood from heart to lungs. Option B, carry blood from heart to brain. Option C, carry blood from aorta to myocardium. Option D, supply blood to the endocardium. Carry blood from aorta to myocardium. Option C is the right answer. Next, 14th question. While caring for a client who has undergone cardiac catheterization, it is most important that the nurse. Option A, provide for rest. Option B, administer oxygen. Option C, check the ECG every 30 minutes. Option D, check the pulse distal to the insertion site. Option D is the right answer. Cardiac catheterization, it is most important to check the pulse distal to the insertion site. Option D is the right answer. Next, 15. Cholesterol is a substance that option A may be controlled entirely by eliminating food sources. Option B is found in many foods, both plant and animal source. Option C, all person would be better off without because it causes the dispose process. Next, option D, circulate in the blood the level of which respond usually to dietary substitution of unsaturated fats for saturated fats. Option D is the right answer. What is the question? Cholesterol is substance that Option D is the right answer. Circulates in the blood the level of which responds usually to dietary substitution of unsaturated fats for saturated fats. Okay friends, today we are discussing medical surgical nursing part 1 question paper, and tomorrow we will discuss part 2 question paper. It is most important for RRB, ESI and Aiims Norcet examination. Most important questions we are seeing. So please do subscribe, share my channel. Thank you students.